A very warm welcome and a good evening to all the participants, organizers, uh, resource person of today's session, Dr. Sudipt Rath sir, chairperson of today's session, Professor P. Hemanta sir, in yet again next session of the research methodology certificate course. Today we are having Dr. Sudipt Rath sir for his talk on औषध Dravya Pariksha Padhhati, Guna Karm, Veerya, Vipaka and Prabhaav. Sir is currently working as Associate Professor in the Department of Dravyaguna. Sir is also Dean Interdisciplinary Studies in the National Institute of Ayurveda. Sir is in charge of Drug Discovery and Development Unit. Also Coordinator of Pharmacovigilance Center, NIA. He is also in charge of the IT cell of National Institute of Ayurveda. Sir is having more than 22 years of clinical experience, including 19 years of research experience. Sir has teaching experience of 13 years and guided 3 PhD scholars and guided 12 MD scholars. Sir is co-PI in 2 major projects, having major grants of 5 crores and 1 crore sponsored by Ministry of Ayush. One is for the Regional Drug Repository project of NMPB, and second one is creation of ABSL3 facility at CURAG under Rajasthan Biocluster for Infectious Diseases, Therapeutics and Diagnostics of SERB DST. Sir is also member of major committees of Dravyaguna, like member of Ayurveda Subcommittee Pharmacopoeia Committee of PCIMH, FAD 26 BSI India, also chairperson of Board of Studies Interdisciplinary Studies from NIA, also member of Board of Studies from Odisha University of Health Sciences. Now I would like to invite sir to kindly deliver his lecture. Please sir.
Thank you. I hope I am audible. Dr. Sarika, please confirm.
Yes sir, audible hai.
Yes, sir.
Okay. So thank you, Dr. Sarika, for the detailed introduction. I don't think anybody is interested to listen about another person. Only thing they want to know who is speaking today. So, but anyway, thank you so much. So let me share my screen. Just confirm whether these slides are moving or not.
Sir, move हो रही हैं.
Okay. So, in this series of lectures that you people are organizing, congratulations to you all. Today we'll be discussing about Dravya research because I don't buy the, equivalence of Dravya as a drug. Dravya is a very vast concept, whereas drug is limited in its ramification and understanding too. So Dravya research and its Pariksha in Ayurveda. We can do it in many other science also. And because the topic look to me a very lengthy one, if I consider everything like Rasa, Guna, Veerya, Vipaka and Prabhaav in the context of Dravya research and Pariksha, it will be lengthy. So I will be confining to myself to Dravya research and Pariksha in Ayurveda in gross terms. So today we'll be touching upon these points. One is what is Dravya research, then how Dravya is being examined or investigated in context of Ayurveda, what are the parameters that we are currently using and what were being used during the ancient days, whether they still hold the relevance or not. Then after the parameters, what tools to be used, whether we have the pramanas, then we have these recent advanced tools that is coming into the picture, how they are relevant for our Dravya research, that also we'll discuss a little. Then everyone always asks what is the applied aspect. Okay, so we'll see what applications can be done of this Dravya research and Dravya Pariksha. And finally, every wise person should know what is the limitation. Well, nothing is beyond limitation. Everything has its own limitation. So whatever Dravya Pariksha we have in the outline of Ayurveda, whether they have some limitation or not, and if they have, then what are they? So first thing, just a minute, this thing is so why Dravya research is being done? That is the first question that we need to think about. Uh, Whether a Dravya has already acted, so we are doing a research to understand how it acted and what actions it did and what was its mode of action. This is one point of the research that we are doing, which we called as revalidation research or understanding research, whatever you may call it. So one point of Dravya research is that we are trying to explain how a Dravya is performing its action, that and to understand this we need explanatory parameters. Then when we are developing a new Dravya, it becomes little tricky. If a Dravya is a single substance, then how do you develop a new Dravya? It is because we are sourcing everything from the nature, that means it is existing. Only when we formulation we are trying to design and develop, then only a concept of developing a new Dravya comes in. Uh, but in context of the current legal definition, we consider dravyas that are not described in our text or maybe in pharmacopoeia coming from exotic sources. They are also considered new dravya in terms of legal definition. So that we may consider as a new dravya. Then we have existing dravyas that we know, but new indications we try to develop. Then this is one area, this new dosage, which is not looked after well. Many times people convert avalehas into syrup, then churnas into tablets without actually giving thought what could happen to its ultimate therapeutic action or pharmacological action when we change the dosage form. So even a new dosage development is a kind of considerable amount of research is required for that. And based on that, we can also have some prediction parameters that if a dravya is having certain values, then what could be the predictive pharmacological behavior of that particular dravya. These also comes under dravya research. Then designing and developing a new formulation where we are using combination of substances, they require research for predicting the pharmacological behavior and therapeutic utility of that particular formulation. Then finally, we do research in context of Dravya for quality assurance. Means what quality we are trying to give to that particular substance or the particular formulation. And in this research is being done or had been done to set critical parameters so that a predictable drug action or Dravya action can be elicited. Because the moment we are setting critical parameters of quality, if a dravya or a formulation deviates from that quality, we are presuming that now it is not going to behave similarly as it should have been done. One minute, how it is going. Okay. Now, the second point is that why should we do a pariksha? Pariksha, I think everybody will know all these slokas that has been written here. We need to do investigation actually before doing any action. This is how things and this is how this world functions. If we go, initiate an action without doing proper investigation and without doing proper evaluation, then we may end up in a huge problem. So that's how this entire text of Ayurveda was also conceived. And they have given most importance to pariksha, that means investigation or evaluation needs to be priorly done before initiating any action. And the pariksha is actually meant to know the entire gamut of activities in all its specifications. So pratipatir nama yo vikara yatha pratipatavya tasya tatha anusthana jnanam. When he says like that, that means you must know about each and every parameter, whether it is a basic parameter, whether it is a secondary parameter, whatever it may be, any factor or any tool that can actually influence the outcome of the activity, those needs to be known and those needs to be evaluated. Sometimes what happens while doing a therapeutic activity, we do evaluate major parameters, but we forget about the secondary or so-called minor parameters. And we just, but at the end of the day, when because of the minor parameters were not actually conducive to that therapeutic action, our outcome totally goes out of prediction. So examine entire spectrum of factors till execution, and you need to do this investigation if you are claiming that you are an expert. If you are claiming you are an expert, then you must initiate your action after proper and thorough examination of the entire spectrum of factors which are required or which are utilized in this particular activity. Now, what is the need of Dravya Pariksha in research, particularly in therapeutic research? Because we are going to use this substance in therapeutic activity. So why should we do investigation of that particular substance? We should rather think about the clinical picture. We should rather think about the diagnostic tools. That's how these things come into picture. But just go back to the text. It says that Dravya is the most important tool that a physician has in his or her hand. Okay. Yat tu kartadhina vyapare sadhakatamam tab karanam. Karanam punar vesajam. That means even if you have everything under your control and your dravya or your aushadha is not up to the mark or it is not actually appropriate, then everything will fall and nothing is going to succeed. Then Dravya is 1/4 part of the total chikitsa activity. Visak dravyani upasthata rogi pada chatushtayam gunavat karanam gyayam vikaraha upashantayat. That means uh, in a therapeutic activity, after Vishak or after the physician, Dravya takes the most important position. So we should examine the most important factor after the physician so that we can predict the outcome of our therapeutic activity. And people are confused about this guna. Gunavatta karana means what should be there in the visak, what should be there in the dravya, what should be there in the upasthata. Charak has given, Charak, Ashtanga, everyone has given 4 odd parameters of everything. Like visak should have these 4 gunas, dravya should have these 4 gunas. That has been written. But if you go to the Karya Karanabad, Guna in Ayurveda is considered as the Karan for the entire Karya. So, in the by the term Guna, in context of research, we must consider everything that contributes to the ultimate favorable outcome of the therapeutic activity. So, if for example, say I am using Amrita, Tinospora codifolia for Pitta Sansaman, then what 4 gunas are to be there? It is written in the text. But say, suppose whether stem is to be used or the leaf is to be used, these are minor things which has been not actually coming to the part of the 4 parameter major parameters. So anything whether it has to be collected, when it has to be collected, all the secondary and the minor parameters also comes under the ambit of guna. So when we are doing a dravya pariksha during a therapeutic activity, we have to consider every factor that is required in that dravya for doing that particular clinic therapeutic activity. It needs to be evaluated and must be made sure that it is available in that particular dravya what you are using. Then once we know that a substance is in our hand, why we should do an investigation even while we are giving it to a particular patient? Then Charak says that Bahu Vida hi Pariksha Tatha Pariksha Vidhi Veda Sukshmani hi Dosha Vesaja Desha Kala Bala Sharira Ahara Satma Sattva Prakriti Bayasham Avastantarani. Here he is talking about the patient, that even if it is written that Pramaya patients will come like this and there are 20 major divisions, but still why we are considering Purusham Viksha as the most underlying therapy, clinical principle, because when a patient comes to a particular physician, there are sukshma or the minor variations will be there for every patient, and we have to, that's why, evaluate every patient in a different manner, and we cannot go with the generalized treatment for every patient. Same way, when we are using this, suppose a particular substance like say Amrita or Ashwagandha, but when it is coming to us, it may come in very different forms. Like it may, sometimes it may come, the sample is tarun, sometimes it is vruddha. I mean, there's matured sample, sometimes immature sample, sometimes dry sample comes into processing, sometimes fresh sample comes into processing. Then there is a possibility of contamination or cross, adulteration of other substances. Then some substances which is required to be actually used as far as people are supplying it as a quath. So all these things need to be evaluated. After that only Rasha, Veerya, Vipaka, Prabhaav, all these things need to be evaluated. So in my experience, I have seen people do investigation of the Dravya. Either they go for the pharmacopoeial parameters, or sometimes they go for our Rasagun, Veerya, Vipaka parameters. But the other parameters, like this variations that may come to the Dravya from sample to sample, needs to be evaluated while actually using it for research purpose or for the clinical purpose. Then there are mainly two types of Dravya Pariksha that we come across in the Dravya research. One is Ukta Dravya Pariksha, another is Anukta Dravya Pariksha. That we all know, that you all know, that there are two types of Dravya Pariksha. One is Ukta Dravya Pariksha, another is Anukta Dravya Pariksha. And there is a lot of debate about what is Ukta and what is Anukta. And unfortunately, in the Ayurveda fraternity, we debate a lot, but we don't go for the solution. Uh, right now, Ukta Dravya means, some people say whatever is not written in the pharmacopoeia, that is Anukta, and some people say whatever is not written in the Samhitas or Nighantus is Anukta. So this kind of debate is going on. But practically speaking, wherever there is no information, or whatever information is not available about a Dravya, that is Anukta. If something is available, then that becomes Ukta. So how Ukta Dravya Pariksha is being done? The approach has been written in Charak Samhita, because Ukta Dravya means we now know, we now have information about that particular Dravya. So whether it may be in the Samhita, it may be in the Nighantus, or somebody else has already done research on that and have published it, which is available in the public domain. So they all will be considered as Ukta Dravya. Why should we do a pariksha to a substance that about which we already know from other sources? Here Charak says that even if tasmat satiyape nirdeshe kuryat uhyam swayam dhiya bina tarkena ya siddhi yadricha siddhireva sa. Means, even if there is information about available about the particular substance in the text, swayam api atra vaidyana tarkyam buddhimatam bhavet utpadyate hi sa avastha desha kala valam prati. That means what Charak is trying to say, that even if there is reference or there is information about available about a particular substance in the text, still the physician at hand must apply his or her own logic before administering the substance. Why? Because every principle in Ayurveda is waiting to be verified in terms of a desha kal while being applied. ये आप लोगों को ध्यान रखना है कि जितने भी हमारे सिद्धांत हैं वो हमेशा ही देश काल मात्रापेक्षी होता है. इसलिए जब सिद्धांत when it is being applied, one has to consider those parameters, because जब हम इसको जेनेरिक लिखते हैं तो देश काल मात्रा को वहां अप्लाई करके लिख नहीं सकते. That's why the acharyas have told that whenever you are applying a principle, you must evaluate at least three major parameters, that where this principle is going to be applied, and how, when the principle is going to be applied, and how much quantity of the principle is going to be applied. So desha, kala, matra, all these are variables that needs to be evaluated on case to case basis. So they will vary from person to person. So even if there is direct information, direct reference available for any substance, still then the physician must evaluate the everything from person to person basis. Otherwise, whatever success you are going to achieve, that will be considered success by chance, and they won't be considered as success in systematic successful procedure. So this actually forms the part of the entire what you call research methodology, that some people do allegate or do criticize the Ayurveda that this is what you call I mean they didn't follow the scientific process to derive the information. But you see I mean, to conclude, Charak says that if there is a chance bias, we are not accepting that. One has to show it by experimentation and repeated observation that it is working. So that's what the modern research methodology also says, that many things do happen, but if you don't know how it is happening, then that kind of knowledge is known as chance knowledge, and this chance bias is not acceptable in research methodology. That's the same thing Charak is telling, that if you are getting some success by chance, that is not something which we are looking for. We are looking for a predictable outcome that you can ensure. So this becomes the research methodology part. Then Charak in Bimanastan has discussed in detail how to go about the investigation of a Ukta Dravya about which information is available. He says that idam evam prakriti evam gunam evam prabhavam asmin desha jatam asmin ritaha evam grihitam evam nihitam evam upaskritam anaya cha matraya yuktam अस्मिन् व्याधः एवं विधस्य पुरुषस्य एतावन्तं दोषम् अपकर्षति उपशमयति वा यद् अन्यदपि च एवं विधं भेषजं भवेत् तच्च अनेन विशेषण युक्तमिति. If you analyze all medical systems that is prevailing in this world right now, you won't find a more comprehensive drug investigation methodology anywhere. He has taken into consideration of all the factors that may influence the outcome of the dravya or the drug action before initiating the action. Evam prakriti means everything that is associated with the substance must be known to you. What is his nama, what is his guna, whatever prakriti means, whatever is its genotype, phenotype, all the information needs to be known and needs to be verified. Then the qualities, gunam, then what prabhav means, what it is going to do, then what is its habit and what is its habitat, when it was collected. So I'm not going into the details because most of you know what point by point what it is. But my point is that uh, Charak has included all the possible parameters that may influence the outcome of the drug action in this approach in Charak Bimanstan 8, that these things needs to be investigated before actually getting engaged into a therapeutic activity. Then how we should approach the anukta dravya? Suppose the information is not available to us, uh, whether it is not available in the Samhita, or it is not available in the Nigantu or Pharmacopoeia, or even the recent published literature. Those anukta dravyas, what would be our approach? We have to apply all the four pramanas here also, and Charak has given a hint how to go about an anukta dravya. He says that we have intentionally and we have also due to ignorance have not kept many substances in the ambit of this samhita, because nahi vistarasya pramanam asti, this na cha api ati sankshepa alpa buddhinam samarthaya upakalpate tasmad anati sankshepa anati vistarena cha upadishtaha. That means if one has to expand the volume of the text, then there is no limit to that. everything in this universe can be used as a medicine. So and they are waiting for the particular condition where it can be used as a medicinal substance. So if every situation will be enumerated and put into an example inside the Samhita, then the volume of the Samhita will become limitless. Similarly, if they go with only one or two examples, it is very difficult for everyone to comprehend what they actually trying to tell. So they have taken a mid path where anati sankshepa anati vistarana cha upadishtaha, and how this is going to be understood and how it is going to be used. Charak says that if you just follow whatever we have written, then it is sufficient for day-to-day clinical practice of you. That's why he says that etavanto hi alam alpa buddhinam vyavahara. So if you are talking of day-to-day clinical practice, mostly whatever is written here, it should be sufficient for you. But if like a researcher, he is trying to venture into new forays, then you become a buddhiman. Buddhimatam cha swalakshana anumana yukti kushalanam anuktartha jnana iti. Means these examples what is available in this Samhita, a wise person should use these as examples to actually predict about the anukta dravyas or anuktartha jnana. Means whatever is not written here, one can predict or one can uh, hypothesize on basis of this information available in this Samhita as examples, and then use his Anuman and Yukti Praman to know about it. Then going further, he says how Anukta Dravya Pariksha should be done. Most of the times people say that Raso Nipata Dravyanam Vipaka Karma Nishtaya Veeryam Yavat Adivasa Nipatat Chaupalabhyate. So that means roughly when we are talking of a single new Dravya, then we must know what is its Rasa, and then why we must know what is its Vipaka, and why we also must know what is its Veerya and Guna also. But there are other information or other references are also available in Charaka Samhita, where he says that how you are going to know about the Anukta Dravya and how you are going to use it. There are two references. One comes in the 8th chapter where he says that Yatcha Anyadapi Kinchit Sat Anuktam Iha Pujitam Vratam Tadapi Cha Atreya Sadeva Abhyanumanyate. Means whatever it comes in context of Sadvrata, that whatever we have written something, and there are other things also there are other things also. So whatever is good, one has to use that. Everything we have not written here. Same way, when he goes to Arnapana Vidyadhya, he says that Arnapanena Ekadeso Ayam Muktaha Praya Upayuka. Means we have spoken about, we have described about the commonly used Arnapana Dravyas, because Dravyani nahi nirdeshtum shakyam kasnena namavihi, because it is not possible to describe about every substance that is that is available in this universe or that is being used everywhere. यथा ननौषधि औषधम किंचित देशजानं वचो यथा द्रव्यम तत् तथा वाच्यम अनुक्तम इह यद भवेत. That means he is telling that जिस how this nanaushadhi मतलब that means that slok from Charak Sutra 26 where he says that अनेन उपदेशेन नानौषधीभूतम जगति किंचित द्रव्यम उपलभ्यते. Same way this principle applies to the ahara dravya also, that there are many substances which is not described or which is not getting mentioned here, but how to use that and how to know about that is that Chakrapani explains. यथा येन प्रकारेण नानौषधम किंचित इति पूर्वाध्याये प्रोक्तम तथा तेन प्रकारेण अनुक्तम द्रव्यम वाच्यम गुणतः इति शेषः. That means to know about medicinal substance, to know about ahara dravya or dietary substance, the guna of that dravya is the key. If you know the guna, then only you can use it. Okay, so like he is telling that purva adhyay hi तत्र द्रव्याणि गुरुखर कठिन मंद स्थिर, that श्लोक इत्यादि ना ग्रंथेन पार्थिवादि भेदेन विशिष्टेन च कर्मणा प्रोक्तानि द्रव्याणि ततश्च अनुक्तम द्रव्यम तेनैव गुरुखरादिना गुणेन पार्थिवत्वादि प्रतिपाद्य यथोक्त उपचयादि कर्म कर्तृकतया व्यपदेष्टव्यम इत्यर्थ. So this is the key, this is the formula that is required to be applied for knowing and utilizing the anukta dravyas. One must know what is the gurvadi guna of the substance, whether it is an ahara dravya or whether it is an aushadha dravya. We need to enumerate the gurvadi guna of that particular substance. And how to know the gurvadi guna of a substance? uh, for that we have tools rasa guna Veerya Vipaka Prabhaav. That 5 tools we will be using. Why Gurvadi Gun enumeration is important? Because Gurvadi Gun is actually manifestation of the Mahabhutik structural basis of the substance. So now he is coming to the pharmacological behavior of the substance. That structural basis will actually pave the way for pharmacological activity or physiological activity. So to know the structural basis in terms of Ayurvedic knowledge, we need to know what is the guna of that particular substance. So the key is that whatever investigation we do and from how we approach it, ultimately we have to determine what is the gurvadi guna of that particular substance. Then there are two types of parameters that we use for Dravya Pariksha. One we call as basic parameters or fundamental parameters or Moolavhuta Siddhanta Pariksha, whatever you say it. They are Rasa, Guna, Veerya, Vipaka, Prabhaav. These 5 parameters. Then there are many associated secondary minor factors like its habit, habitat, what time it was collected, all these things which has been enumerated in Idavam Prakritim Shloka. So these are 2 basic types of parameters that is used in research for Dravya Pariksha. Then what is this Rasa, Guna, Veerya, Vipaka, Prabhaav? These are 5 things which is the bridge that links a Dravya with its karma, that we commonly know as 7 Padhhati in Dravyaguna or Dravya Pariksha. So Rasa, Guna, Veerya, Vipaka and Prabhaav is the bridge which will link the Dravya with its ultimate pharmacological action. And this Rasa, Guna, Veerya, Vipaka, Prabhaav all are nothing but manifestation linked to the Pancha Mahabhuta, and the manifestation depends upon the Mahabhutik Utkarsta of that substance. I know it is a very complicated and confounding topic, that how a Mahabhutik Utkarsta is actually manifesting one set of rasa, then it goes to manifest another set of gunas which is not comparable. This is little bit tricky. How Charak and other people have envisioned it, it's like that the Mahabhutik status of the substance is dynamic. So it may be somewhat during the preliminary stage where you have not administered it, but after you administer it, it now interacts with the body. So when it interacts with the body, there is a possibility of transformation of Mahabhutik status. There is also a possibility that some Mahabhutik status which was inactive or dormant when you administered it, but due to the biological interaction, it becomes activated. So this Mahabhutik status is a continuously changing dynamic process, and it also depends upon the biological interaction that the substance is encountering. That's why it becomes tricky and it becomes complicated also, because things are moving dynamically. What we say now, it may not hold good in the next step. So but ultimately rasa, guna, Veerya, Vipaka and Prabhav, they are nothing but manifestation or an expression of the Mahabhutik status of the substance during that particular state. And it is comparable to the structure activity linkage that we study in the modern pharmacology, where they says that similar structure will lead to similar activity. So when we say that similar structure will lead to manifestation of similar rasa, then indirectly we are trying to say that similar rasa means the substance is going to show similar physiological and pharmacological activity. Now coming to the modern pharmacology, how it says that the central axiom always remains that activity of a chemical is always linked to its structure. Okay, so the modern pharmacology, it says that because they are using chemical substances, they define everything in chemistry. Is saying that activity of a chemical substance is ultimately linked to its chemical structure, and chemical structure grossly has three proponents. One is molecular geometry, another is electronic structure, and also the crystal structure of the molecules. So these three main major parameters ultimately determines and describes the pharmacological activity of that particular substance. And molecular geometry involves spatial arrangement of atoms in a molecule, and also the chemical bonds that hold the atoms together. So these are all dynamic situations that can happen when we are talking of a natural product. Then quantitative and qualitative structure activity relation determines the biological activity. So these are all for part of combinatorial chemistry, which explains the drug action. So it is not that only the Ayurvedic Dravya pharmacology is complicated, even the modern drug pharmacology is complicated, because alteration in structure can actually change the overall properties of a compound. That's how even the modern chemistry or modern pharmacology functions, that if you change only one radical, then the entire pharmacological activity of that particular molecule is changing, even if the molecular formula remains the same. As we will give an example how they play with the molecule by just replacing one radical with another radical. You see, the top one is a morphine molecule. So if we modify this R2 radical, then if you do it, I mean, it is CH3, then analgesic property will come. Then if you add another CH2, CH3, then opioid agonist activity decreases. Similarly, there are so many options available. Just only R2 replacement, if one can do with this is 5 examples I have taken, then you see the pharmacological activity is changing for that particular substance. See, the same thing can happen to our substance also, and because we are sourcing it from the nature, so the nature can actually change change this chemistry of that substance from sample to sample. So sometimes some sample the pharmacokinetics is better, sometimes the of the same sample the pharmacokinetics is not as per the previous sample. So these things do happen, and these are having solid scientific chemical basis of the variation. Why ashwagandha in one batch it was working well, and why it is not working that much well in the other batch? They have solid chemical basis, and they have also logical basis of this variation. That's why even the WHO is also accepting that variation within a limit in natural products is acceptable, because you cannot control the nature which is producing them. So I will today I will give you only one example of rasa, how rasa can be used to actually predict the pharmacological activity of substances. We all know rasanartha rasahas tasya dravyam apakshitistata. So that means rasa by definition is the knowledge which is perceived through rasana indriya. I am just translating the English of rasanartha rasa. Knowledge perceived through rasana indriya is known as rasa, which can be roughly understood as gustatory sensation, and this rasana indriya is located at jiva. And Charak also says that rasa is experienced the moment a substance come into contact with the tongue, where because rasa is a pratyaksha praman, and pratyaksha knowledge is perceived tadatya, means immediately. So this is one parameter that Charak says. Then Charak defines rasa and anurasa, where the clearly perceived knowledge is considered as the rasa, and any other perception which is either lower in intensity or it is perceived afterwards or mildly is called as anurasa. This is the three information that we have in as far as rasa principle is considered. Then but when you go to application of rasa in in determining the pharmacological properties, action, and therapeutic utility of substance, you will see that they have not kept themselves limited to that this is the information or this is the knowledge that we are acquiring only through gustatory sensation. They have actually expanded its utility and its applications beyond taste buds, and you can say retronasal olfaction, chemesthesis, irritation, all has been actually taken into consideration while conceiving the concept of rasa. How you are going to understand this? See, say the sweetness of Ikshu, sweetness of Yashtimadu, sweetness of Aragvata, sweetness of your Godhum, they're all sweet in taste. But when you taste it as a perceptor, you know the difference between the sweetness. It is not only the difference of the intensity of sweetness that we are talking about. Actually, the taste, the sweetness of Ikshu is something different besides the intensity of sweetness, and the sweetness of yashtimadu is something different. We can even if we close the eyes, even if we close the nose, everything, if you put it in the mouth, if you are experienced, then you will say that this sweetness can is attributed to yashtimadu. Then you can say it is attributed to ikshu, or it is attributed to godhum. That differentiation we are able to do on day-to-day basis. So, but if while coming into the picture of so many medicinal substances, it becomes complicated now, because now you are playing with say 200 to 300 or substances which has some kind of sweetness or some kind of madhurutva to it. So only that much experience, that much practice, and that much expertise can give you the knowledge that by without opening your eyes, by just testing the substance, we can identify which substance it is. But from the limited example, we can very well comprehend the concept that on basis of the taste sensation, even the similarly tasting substances we can differentiate. Say that's how, if you define the rasa, it actually refers to a complex totality of subjective experience. It is a subjective experience, but it is a complex totality, because when we are putting something in mouth, we are just not only receiving the information from the taste bud, we are also uh, experiencing certain flavors, certain irritations, certain reflex perceptions, all are being complexly perceived by the perceptor to give a knowledge about the substance. And whatever sensors are available in the mouth, and up to some extent the nasal passages, because we cannot block the nasal passages when we are putting a substance in the mouth. So everything, this olfactory, chemesthetic receptors, all of them do play a role when we are experiencing a rasa. But uh, I'm taking you to the rasa sambasa. uh, then when we try to enumerate the number of rasas, so by this meaning, what I am telling, it says that every substance has a unique rasa, right? Every substance has a unique rasa, because I am giving you a very rudimentary example of four madhur substances, but we all can differentiate the sweetness or the madhuratva of yashti madhu, ikshu, without actually being very clearly put terms to that how we differentiated it, but our subjective experience says that it is different. So he's if you extend it, that means every substance has a unique taste, which if you are good enough in your experience, if you are good enough in your precision of understanding, and if you are uh, if you are an expert, then you can say that the bitterness of kutuki and the bitterness of guduchi and the bitterness of kalmeg, besides the intensity factor, they are different, because as a subjective experience we can say different. But when they try to enumerate the rasas, they confined themselves into 6 types of rasas, that is called as the six major rasas. So what rasa denotes? It denotes the Mahabhotik status, because we know that Madhur means which Maharasa's dominance is there, and Tikta means which Maharabhuta dominance is there. We all know that. So it denotes a structural basis of the substance. It also denotes the gunas. So that means it also denotes the functional attributes that may be present in the substance. And because all the rasas are associated with a certain set of karmas, it also denotes pharmacological action. So that means, to conclude, to sum up, rasa denotes not only structural functional basis, it also uh, describes the possible pharmacological activity a particular substance can have. Then, as I was discussing, they are primarily six in number, but already the text is says that asankhya ras is a possibility. So that can be numerous, and rasa can be used both as an explanation tool, and also it can be used as a predictive tool. For example, if a substance has already done a has already done a pharmacological action and therapeutic activity, for example, say uh, pitta sansaman of Ctenospora cordifolia due to Tiktarasa, it has done pitta sansaman. Then we can explain how it acted. Because of Tiktarasa, it acted. Same way, when we do not know what a substance is going to do, based upon its Tiktarasa, which was similar to, say, Amrita, then we can predict that because it is Tikta in taste and it is also tasting a bit similarly to Amrita, then it should do a Pitta Sansaman Karma. That prediction one can also do. And the prediction in research, as we all know, who is into drug designing and development, designing and development of a drug is a very tricky business. It carries a lot of failure also, and the market value of the researcher depends how much success he is getting. If one out of 10,000 molecules one can predict, which can be converted as a drug, then that person is considered as a very successful drug designer and developer. Similarly, when we are predicting on basis of rasa, we may go wrong, but with experience, with expertise, people can predict with certain amount of confidence level. So that's how the market value of a person who can predict the pharmacological activity of a substance on basis of the rasa will go up if his predictions are more likely to come true. Then importance of rasa in chikitsa, that's why Charak says that yah syad rasa vikalpagyah syat cha dosha vikalpapit na sa muhyat vikarana hetu lingo upashanti. So that means ultimately Charak is telling that if you can understand the rasa of the substance, then you are not going to fail in your therapeutic activity. And how it is going to, how this line is holding good, I will try to explain you in the next 10 minutes. After that, we will go for the discussion session. On molecular basis, how this rasa and pharmacological activity is linked, you can see. There was one article which says that ibuprofen and oleocanthal is isolated from olive oil. They are similar in taste. The same kind of soreness is there, which is which also irritates at the throat level. The same kind of soreness is perceived both for ibuprofen and also oleocanthal. They are structurally dissimilar. There is no, when you elucidate the chemical structure, the ibuprofen and the oleocanthal, they are structurally highly dissimilar, but they exhibit similar anti-inflammatory activity. Both are COX-1 and COX-2 inhibitors. Okay, this is published in one article. So they have not gone beyond this, but if we link this information to our Ayurvedic understanding, what is trying to tell that if substances are similar in taste, they may be chemically different, I mean structurally different, but because they are similar in taste, they are likely to exhibit similar pharmacoactivity. This is one example which has been published. So you just extend this information. This information is for a compound. Now suppose we take it down to a molecular level. That means every molecule has one particular rasa which is precisely related to its biochemical structure, and because it is the rasa of a molecule is associated with a biochemical structure, it also will have the linkage with the pharmacological properties of that particular molecule. Now, on basis of the molecular information available of the human physiology, I just tried to work out how many possibilities of rasas are and its receptor binding activity is possible with the current available physiological knowledge. We have 6 primary rasas. Then we know that umami is also considered one of the rasas. Then there is metallic taste, there is alkali taste, there is meaty taste. There are so many other tastes also. I have just taken the more common and more prevalent taste that we people do speak in day-to-day language. If you consider that, then the independent dimensions to subjective sensation of rasa becomes almost 10. Okay, 6 rasas we have, then a metallic taste is there, umami taste is there, alkali taste is there, meaty taste is there. These things people do express in day-to-day life. I have is there any problem, Sarika?
No, sir. Clear voice, clear. No problem, sir.
Okay. So, if we take a reasonable estimate, then we will see that the subjective experience of taste can be at least around 10. Okay. Similarly, I've just kept it very concise, but if you go for the olfactory physiology, you will say that at least 5 to 10 cognitive discrimination takes place at the olfactory level, and it is more clearly explained as far as optic cortex is there, but olfactory cortex also modern physiology try to explain. How much cognitive discrimination one can do at an human level is at least 5 to 10. So if we add this 10 plus 5 and 10, so 15 to 10 dimensionality of rasa can be conceived. 10 I am coming from the point second, and 5 to 10 I am taking from point 3. So if you add to these two, then it becomes 15 to 20 dimensionality of rasa is possible, and it is a conservative estimate. With little bit of practice, everybody can actually conceive this 10 type 15 to 20 subjective dimension of rasa. Then if you take the intensity, then at least there are 4 levels of intensities there. Either it is non or weak or moderate or strong. At least these 4 differentiation a common person can do. So if you take that 4 levels, and now 15 to 20 dimensions are there, if you mathematically calculate it, then it becomes 4 to the power 15 or 4 to the power 20. This kind of dimensional differentiation is identifiable, and with practice people can do that. Okay, so and this number comes in between 1 billion to 1 trillion. That's why Charak says that rasa possibilities asankhya. We have seen here that based upon this modern physiological receptor and binding what you call on explanation, at least 4 to the power 15, 4 to the power 20 is this kind of subjective dimensionality of rasa is possible. And now you link this to the we link this physiology to the pharmacology. What he says that for appreciation of a taste or appreciation of smell, there needs for a binding that needs to happen. So molecules bind to an enzyme active site because their conformation including its size and shape. So that means one molecule is going to bind with a receptor only when the size and shape are appropriate and they are conforming, then only binding happens. Any differences, any deviation, they are not going to bind. So their chemical moieties are in the right places to produce binding. So if we link these two, then next thing comes, given that the criteria for molecules to bind to specific enzyme active sites are so similar to criteria for their binding to the taste and smell receptor in the mouth and nasal epithelia, it is difficult to conceive that a molecule capable of binding to a particular site either as a substrate or as a drug would not possess a different rasa from another molecule binding to a different enzyme active site. So, to explain this, what is trying to tell that a substance to have its unique taste must bind to a unique receptor, and because this receptor and ligand binding also responsible for pharmacological activity, it is likely that a substance which is specifically binding to a particular type of taste receptor, same way it is going to bind with a particular type of pharmacoactive receptor. Therefore, if we can differentiate that subtle level of rasa differentiation, then we can well differentiate the likeliness of a particular substance binding to a particular uh, receptor. Sorry. Okay. To express this quantitatively, the number of identifiable tests that what I feel is we will become 10 to the power 9 to or between 10 to the power 12, which is far greater than the number of active sites of all enzymes in the human body. I hope you got the point. On basis of this physiological calculation, we can say that if our sensation is correct and precise enough, we can differentiate. There are possibility and potential identifiable test will be at least 10 to the power 9 or 10 to the power 12. And this number is a far, far greater number than the actual active sites that is available in the human body. So that's why Charak has conceived that if you know what is the exact and unique taste of a particular substance, you can identify what could be the exact possible pharmacological activity a substance is going to elicit, because beneath this identification of rus is actually a concept that is going, that how a substance molecule is getting binded to a particular type of receptor. So each such site probably has its own identifiable rasa test, and rasa provides enough potentiality available information to distinguish molecules of all possible pharmacoactivities. That means that's why Charak in Sutrastan 26 has dealt more with the rasas, and because this is the only tool they had at a human level to predict about pharmacological activity. After that, no tool, even during the ancient times, was pratyaksha, or even now today also, it is not pratyaksha. So at a human level, only one tool they had, that is rasa, on basis of which one can predict its physiological functioning of the physiological impact of the substance or the pharmacological activity of the substance. So to conclude, I agree with Charak that taste sensation is unique to each substance. If we are good enough, we can identify that uniqueness. But every uniqueness has its own pattern of similarity. So that this unique taste of a substance also indicates unique receptor binding character. with practice one can correlate which type of test binds to which type of receptor and also at which sites, because sometimes site specific receptor binding is more important to be identified, and prediction depends upon the precision of experience and practice. So if we know that a particular substance tastes like this and it goes on to show this kind of pharmacoactivity, and when we come across a substance which tastes a little bit similar to that, then we can predict that this substance is also going to behave like this. And the gross precision, I mean the grosser is our experiential ability, the grosser differentiation we can say. Like suppose I cannot I'm giving an example. If one person who is not able to differentiate the bitterness of a say bitter gourd or and kotuki and then your guduchi and say kalme. Suppose one person is not able to differentiate the bitterness of these four substances, then that person cannot also differentiate based on the tiktatva what these four substances are actually going to do at individual level. He will have his gross what you call prediction that because they are tikta in nature, they are going to do pitta sama. But because he is not able to softly differentiate between the tiktatva of guduchi, tiktatva of kalmega, tiktatva of kutuki, or tiktatva of chireta, he is now beyond that he cannot differentiate. But a person who can identify the difference between these four tiktattvas, he will have a better prediction. Similarly, the more minor level and more minute level experience of rasa one person can does, one they can predict it in a more precise way. So identification of pharmacoactivity through test is a possibility, and yeah, we can give an example of how your what is that name, ginseng, it tastes a little bit like say, ashwagandha. So one can say because it tastes like ashwagandha, it is likely to behave like ashwagandha. So my point is that there will be six rasas, but every rasa will also have some kind of, sorry, every substance will have some kind of uniqueness to that taste also. So the rasatva of ashwagandha is not actually rasatva of I mean it is not entirely only tiktatva or say kasayatva, whatever it is having. It has its own dimension. That dimension of the substance, if we can identify, and when we come across come across an unknown substance that it is uh, similar to this particular substance, then we may predict the pharmacological activity. And in case of ukta dravyas, uh, I have seen many people who actually taste the substance while the raw material they purchase. They do taste the substance, and by just simply testing, they will say it is not up to the mark. This is not up to the quality. And if asked how you, I mean, did it, then that kind of, I mean, to express it in terms, it is not possible. But when someone is actually doing a test, then he is able to do that. Now, when you come into modern scientific parameters, uh, the question of reproducibility comes, that whether only one investigator is going to do that. Well, that is one thing one needs to know. If I am not a good enough researcher, then I cannot expect that I will be going to emulate the other researcher also. But in sorry, as far as research prediction is concerned about the pharmacoactivity, if someone has this test perception, then he can actually say about the possible pharmacological activity of substances whose pharmacological activity is not known. This is how it can be used. It may not be that well used in the what we call in quality evaluation, because in quality evaluation then the investigator becomes one. But when it comes to the pharmacoactivity prediction, one or two researchers are enough. If they know the trick, then at least they can save a lot of time in new drug designing and development. So with this, I think we'll conclude today's lecture, and any discussion and questions. Thank you.
Thank you very much, sir, for such a nice, elaborative and informative session. Now the session is open for queries. Anybody who is having queries about the topic can drop their queries in the chat box or can raise their hands.
Dr. Rajni Thakur, please ask your queries.
हाँ जी सर।
Ma'am, okay.
नमस्कार सर। सर आपका लेक्चर बहुत ही आई क्लीनर था, इट वाज जस्ट वेरी नाइस। सर मुझे दो बातें मेरे दिमाग में आ रही थी, वो मुझे पूछनी है। एक तो ये तो हो सकता है आउट ऑफ टॉपिक हो, लेकिन आपकी नॉलेज देख के मेरा को हुआ कि मैं आपसे पूछ लूं कि हर्बल एक्सट्रैक्ट्स जो इस समय मार्केट में चल रहे हैं, उनका इन रस पंचक सिद्धांत या इससे क्या प्रभाव है, क्या है, क्योंकि मार्केट में भी एक्सट्रैक्ट्स भी चल रहे हैं। दूसरा मेरा क्वेश्चन है सर, जैसे हम रसन इंद्रिय का प्रयोग कर रहे हैं, तो क्या आयुर्वेद में ऐसा काम हो रहा है जिसमें हम डिग्री ऑफ तिक्तता या डिग्री ऑफ मधुरता का पता हमें चल रहा हो, या ये चीजें हमें सामने आ रही हैं या आ जाएंगी इन फ्यूचर, कि गुडुचि है या कालमेघ है या चिरायता है या कोई और द्रव्य है, वो इतना कटु है या ये इतना मधुर है, डिग्री ऑफ देयर टेस्ट। थैंक यू सर।
ओके, मैं आंसर दूं?
हाँ जी सर,
अच्छा,
वेलकम सर।
ओके। पहला जो प्रश्न आपने उठाया ये एक्सट्रैक्ट के बारे में, इसके बारे में ऐसे मैं 2000 आई थिंक 10 में ही एक आर्टिकल हम लोगों ने लिखा था। जितना कंफ्यूज्ड अभी आप है उससे ज्यादा कहीं कंफ्यूज्ड मैं था कि ये जो हम लोग तब एक्सट्रैक्ट पे काम कर रहे थे इंडस्ट्री में, कि ये सफेद मूसली तब ज्यादा चलता था, तो ये सफेद मूसली मधुर था, उसका एक्सट्रैक्ट जो है ना बिटर है। तो फिर मुझे ऐसा लग रहा था कि जब मधुर से हम इसको तिक्त में परिवर्तित कर दिया तो एक जैसे अब इसका गुण कर्म कैसे रहेगा। ठीक है, ऐसे मैक्सिमम ऑफ द एक्सट्रैक्ट इफ यू से दे आर नॉट एक्चुअली, मोस्ट ऑफ द एक्सट्रैक्ट्स आर आइदर कसाय और तिक्त इन टेस्ट, वेरी रेयरली दे मेंटेन द मधुर रस। तब मुझे भी लगा कि ये बदल जाता है, इसलिए इसका फार्माकोलॉजिकल एक्टिविटी बदल जाना चाहिए, गुण कर्म बदल जाना चाहिए। पर जैसे जैसे अनुभव और लोगों के साथ हम लोगों की चर्चा हुई ना, आप देखिए जो रस गुण वीर्य विपाक है वो स्टार्टिंग मटेरियल की होता है, वो कभी भी कल्पनाओं की नहीं होता है ना। जैसे आप च्यवनप्राश की वीर्य विपाक की कल्पना नहीं की जाती है। च्यवनप्राश की जो आरंभक द्रव्य है उन्हीं की रसगुण वीर्य विपाक की बात वो करता है। ठीक है, तो ये जो एक्सट्रैक्ट है वो अपने आप में एक कल्पना है, एक्सट्रैक्ट अपने आप में एक द्रव्य नहीं है। इसीलिए उस द्रव्य का जो रसगुण वीर्य विपाक है वो तो उसके आरंभक द्रव्य की रसगुण वीर्य के अनुरूप रहना चाहिए, अगर कल्पना आपकी युक्तियुक्त है। अगर आपकी कल्पना युक्तियुक्त नहीं है तो आपका जो आरंभक द्रव्य का रस गुण विरूपक था वो परिवर्तित हो गया और वो आगे काम नहीं करेगा। इसीलिए जब हम लोग आप थोड़ा चिकित्सा स्थान में देखेंगे बहुत सारे जगह वो लिखता है कि किन द्रव्यों को और किस रोग में किन कल्पनाओं में यूज करना है। ठीक है, जो वही द्रव्य जब घृत रूप में जाएंगे वो प्रमेह में प्रयोग होते हैं, प्रमेह पीड़का के रूप में पीड़का में प्रयोग होंगे, और वही द्रव्य क्वाथ के रूप में जोर में ही प्रयोग होंगे, वो प्रमेह में नहीं प्रयोग होंगे। So that means the same substance when the कल्पना changes it also changes its pharmacological activity कल्पना के आधार पर, क्योंकि आप संस्कार करते। और जब एक्सट्रैक्ट कुछ चीजें एक्सट्रैक्ट होने लायक है, ये मेरा पर्सनल एक्सपीरियंस है, हर एक्सट्रैक्ट जो है वो फार्माको एक्टिविटी को एनहांस करता है, जरूरी नहीं है। एंड इट इज ए ग्रे एरिया ऑफ रिसर्च, बहुत ही कम काम इस पे हुआ है। इट मे बी ड्यू टू द कॉमर्स इन्वॉल्व इन इट, कि जो अश्वगंधा है, क्या अश्वगंधा की एक्सट्रैक्ट अश्वगंधा की चूर्ण से बेहतर काम करता है कि नहीं करता है, ये उस रिसर्चर जो एक्सट्रैक्ट बनाता है उसका ऑब्लिगेशन है बताना कि चूर्ण से मेरा एक्सट्रैक्ट बेहतर काम कर रहा है, और कर रहा है तो किन पैरामीटर पे काम कर रहा है। क्योंकि हमने दो चार स्टडी किए हैं, जिसमें जो सफेद मूसली की स्टडी, क्योंकि हम एक्सट्रैक्ट बनाते थे, हमने स्टडी किए थे, तो हमें ऐसा कुछ भी इंडिकेटिव एविडेंस नहीं मिला कि सफेद मूसली एक्सट्रैक्ट इज एक्चुअली बेटर मेडिसिनल सब्सटेंस देन द सफेद मूसली पाउडर, या द क्वांटिटेटिव वॉल्यूम ऑफ द डोज हैज रिड्यूस्ड, बट इट हैज आल्सो इंक्रीज द कॉस्ट ऑफ द मेडिसिन। तो मैं जो
Yes.
5 रुपया में दे सकता था, उसको 50 रुपया में क्यों दूं? क्यों? सिर्फ यही है कि मुझे 3 ग्राम से उसको 500 मिलीग्राम करना था। इस तरह की इंफॉर्मेशन बहुत कम एक्सट्रैक्ट के बारे में आ रहा है, और लोग उसके ऊपर काम तो कुछ कुछ हुआ है। अगर आप आर्ट्रीमिसिया का और आर्ट्रीमिसिन का देखेंगे, यूजुअली एक्सट्रैक्ट के साथ कुछ कुछ एडीआरस भी आना शुरू हो जाता है। एक तो ये रहा, और दूसरा प्रश्न आपका जो था, अ, वो क्या बोल रहे
कि
थे? मैं
सर एक ये कि रसन इंद्रिय का जैसे आपने बताया कि वो हमें ज्ञान देता है, डिग्री ऑफ द टेस्ट, तो इसके
हाँ,
अतिरिक्त क्या हमारे आयुर्वेद में ऐसा है, कोई बुकलेट आई या कुछ डाटा है हमारे
नहीं,
पास जो
डिग्री
बताएगी?
डिग्री ऑफ टेस्ट का एक थ्रेशोल्ड वाला टेस्ट होता है कि आप इसको डायलूट करते जाइए कितना क्या है, पर जब हमने जितने भी टीकाकारों को देखा है, उनका ऐसा मानना है कि ये एकदम सब्जेक्टिव एक्सपीरियंस होता है, और इस पे सिर्फ इंटेंसिटी तो एक फैक्टर है डिफरेंस का। मान लीजिए हम 10 मधुर द्रव्यों को लेके जाते हैं, तो 10 मधुर द्रव्यों में जो मधुरत्व है, अगर हम छोटे छोटे और कॉमन चीजों को लेके बात करते हैं, तो हमें भी समझ में आता है कि इनमें अंतर तो है। ठीक है, जब हम औषध द्रव्यों में चले जाते हैं और थोड़ा सा हमारा एक्सपीरियंस और एक्सपर्टीज नहीं है, तो हम कंफ्यूज होते हैं कि ये किसके मधुरत्व है, लेकिन कॉमन में हमें समझ में आता है। ठीक है, तो ये जो इंटेंसिटी है, दिस इज वही मैं आप लेक्चर में बोलना चाहता था कि जो इंटेंसिटी ऑफ रस या इंटेंसिटी ऑफ ए पर्टिकुलर रस है, वो सिर्फ एक फैक्टर है डिफरेंस का। देयर आर मेनी अदर फैक्टर्स व्हिच डिफरेंशिएट द सेम रस इन सिमिलर सब्सटेंसेस, की जो मधुर द्रव्यों में मधुरत्व में सिर्फ उनकी मधुरत्व की जो इंटेंसिटी, वो एक डिफरेंस नहीं है, उनके कैसे वो फ्लेवर देता है, हाँ, कहाँ वो टेस्ट आता है, ये बहुत सारे माइन्यूट डिफरेंसेस है।
जी
अ, ये सब बेसिकली दिस थिंग, ये क्योंकि ये सब्जेक्टिव एक्सपीरियंस है, तो यू नीड टू डू ए लॉट ऑफ प्रैक्टिसिंग। इसलिए जिसको रसविद बोलता था, वो टेस्ट करके उसको दिमाग में एक पिक्चर सा सेट करता था कि ये अश्वगंधा के जैसे लगता है।
जी
ये जो पहले कुछ लोग, हमारा जिनसिंग तो एक्चुअली वहां से आया, तो बहुत सारे लोगों को हाँ जी सर। सर नमस्कार सर। तो आई होप जितना मुझे पता था मैं आपको एक्सप्लेन कर पाया।
अंजनी सर, वेरी नाइस, थैंक यू सर, थैंक्स अ लॉट,
थैंक यू।
थैंक यू।
Dr. Kranti R. Vardhan, please unmute yourself and ask your query.
Good evening, sir. Good evening, Dr. Sudipt ji.
हाँ जी
It was a great presentation, sir. The way you have explained it is too good, but we are at loss, sir, because you have explained only one aspect of Rajasthan Veerya. It would have been better if you have explained Guna, Veerya, Vipaka, and Prabhaav also. So,
वो एक क्लास है
and,
ना, और एक मेरा क्लास है सर 27 को, इसलिए मैंने सोचा अगर गुण को इस लेवल में लेके जाएंगे ना, वो अपने आप में 1-1.5 घंटा मांगता है।
okay. And my question, sir, my basic question, see, जब हम रसत्व की बात कर रहे हैं ना सर, see, it is all just because of gustatory receptors. Then आप 4 drugs बोले, कषाय के drugs, that is okay. That is, they are all single drugs. We can at least find out the rasatva out of them. But when we talk about kashayas prepared in South India, kashayas prepared in Kerala, then what is their position of Rasatva, sir? And my second question is, do you really do you re, do you really believe in Kashaya, or what is your opinion on Kashaya?
See, sir, Vardhan ji, I think I have already answered about the first question query. जितना मुझे समझ में आता है, और जितना हम लोगों के, कि जो रस गुण विवेक जो ये है, ये कल्पनाओं की कल्पना नहीं की गई है। ये तो मूल द्रव्य की जो आरंभक द्रव्य है, जो रॉ मटेरियल, स्टार्टिंग मटेरियल है, उन्हीं की रसगुण वीर्य विपाक की बात होती है। तो जब आप कषाय करते हैं तो दिस इज एक्चुअली मल्टीपल ड्रग्स आप यूज करके उसको एक कल्पना बनाते हैं, चाहे वो आप क्वाथ की फॉर्म में ले रहे हैं या चूर्ण की फॉर्म में ले रहे हैं, वो कषाय कल्पना में आ जाता है। और आई होप भाई कषाय जो आप बोल रहे हैं वो क्वाथ को ही बोल रहे हैं, जो साउथ इंडिया में हम लोग कषाय की बात करते हैं तो वो ओनली क्वाथ तक सीमित है। तो वो क्वाथ में जो द्रव्य आया उसकी रसगुण वीर्य के हिसाब से वो काम करेगा, इस तरह से कल्पना हमको शास्त्र में आता है। लेकिन जब ये कॉम्बिनेशन होता है, कभी कभी जो संयोग गुण आ जाता है परादी गुण का ना, तो संयोग होने से कुछ नया कुछ आरंभ किया है, तो वो एक्सपीरियंस से आता है लोगों को। यू कैनॉट प्रेडिक्ट ऑन बेसिस ऑफ द रसगुण वीर्य विपाक ऑफ द स्टार्टिंग मटेरियल, वो कर ही नहीं सकते। दैट्स हाउ आई अंडरस्टैंड। एंड जो कषाय की बात आता है, आई डू बिलीव दे वर्क, ठीक है, ये बहुत, अब हम लोग यहाँ जयपुर में बैठ के भी वहाँ की कषाय को यूज करते हैं और वो रिजल्ट देता है पेशेंट को। और ये फोरम थोड़ा अलग है तो इसलिए बोलना नहीं चाहिए। मोस्ट ऑफ अस अनफॉर्चुनेटली दे वी डू नॉट अंडरस्टैंड, व्हेन वी अंडरस्टैंड वी डू नॉट प्रैक्टिस आयुर्वेद। We try to understand think in a very different perspective and just substitute the drug with herbal drug and think that we are doing ayurveda.
Sir.
इसीलिए थोड़ा प्रॉब्लम हो रहा है।
And the question again, the questions are same question. Can kashaya be given in a Jangala Desham, or kashaya should only be given in Anupadesham?
आप भी जानते हैं ये इतना सिंपल आंसर नहीं है। एक फैक्टर को देख के जंगल देश में कैसा है प्रोहिबिट नहीं कर सकता।
नहीं, आपका एक्सपर्टाइज मांग रहा हूँ सर, बस और कुछ नहीं, आपको टेस्ट करने के लिए नहीं।
नहीं
But I wanted to have some enlightenment on that, sir. That's it.
नहीं, हम लोग देते हैं यहाँ, हम लोग यूज करते हैं कषाय को। ये बात सही है कि हम ऐसा नहीं कि क्या बोलते हैं उसको, यहाँ घृत साथ में है तो हम घृत से स्नान नहीं करवा पाएंगे। कुछ लोगों में करवा लेते हैं, कुछ लोगों में नहीं हो पाता है, वहाँ वो पुरुषम पुरुषम वाला चलता है। और रोग और रोगी की स्थिति के ऊपर भी डिपेंड करता है ना, वो कषाय सहन योग्य है या नहीं। चाहे आनुप देश में भी सभी व्यक्ति कषाय सहन योग्य होंगे, ऐसा मैं भी नहीं मानता। मैं ऐसे बेसिकली उड़ीसा से बिलोंग करता हूँ, तो हम हर किसी को वहां भी कषाय नहीं दे पाएंगे ना। ऐसे ही यहाँ हर किसी को कषाय नहीं दे सकते, ऐसा नहीं है। और आयुर्वेद आपको सबसे ज्यादा क्या बोलते हैं उसको, फ्लेक्सिबल और सबसे ज्यादा लिबर्टी देने वाला साइंस यही है। आप और थोड़ा कुछ मिला के दे दो, हो जाता है ना।
This is a good answer, sir.
नहीं, एक्चुअली ना ये हम लोग कभी कभी बात करते हैं तो इससे ज्यादा लिबरल साइंस दुनिया में बना नहीं। बोलते हैं आपको जो करना है करो, अभी हमने नहीं बताया तो आप उसमें थोड़ा घी डाल दो और दे दो, अगर आपका काम हो रहा है। वो इज स्टॉपिंग, वी आर नॉट स्टॉपिंग एनीवन, नो। इसलिए आई थिंक एवरीथिंग कैन बी यूज्ड एवरीवेयर इफ द युक्ति लास्ट में यही आता है कि अगर द फिजिशियन नोज हिज लॉजिक देन ही कैन यूज इट।
Dr. Abhijit Singh, please unmute yourself and ask your query. Dr. Abhijit Singh.
Hello,
हाँ जी, सुनाई दे रहा है अभिजीत जी, बोलिए।
am I audible?
यस यस।
So, so my question is very simple there. So, how to evaluate the Rasaguna Virya Vipaka in modern science according to the pharmacological activity of herbs?
Okay, you know the pharmacology activity. What is the starting point? If you know the pharmacology activity, now you are trying to determine the Rasaguna Virya Vipaka, or what is the starting point?
So starting point है कि एक हर्ब्स का एक फार्माकोलॉजिकल जो एक्टिविटी होता है, तो गुण गुण बीजो विपाक या रस से उसको कैसे मैं आइडेंटिफाई कर सकता हूँ?
Abhijit ji, rus is a very simple tool, no? You don't need anything else. You need your tongue to be good enough, right?
Okay.
So, and that's why he says that everything starts from the rasa. Rasa is the only tool that you have as a pratyaksha. All other things will be anuman and also depends on logic. Okay, so my point is that when if I do not know anything about the herb कि ये कैसे काम करता है या इसके पास कोई रिपोर्टेड एक्टिविटी है कि नहीं, if I do not know anything, then I need to know only one thing, whether it is orally toxic or not. नहीं तो मैं उसको चखूंगा तो फिर मेरे दो चार वॉलंटियर या मैं खुद गया. ठीक है. सो इफ वी डू नॉट नो एनीथिंग अबाउट द सब्सटेंस एंड वी नो दैट इट इज नॉट orally toxic, then we can go for the test. If we test it, and the tester should be a good enough experienced person. अगर वो good enough है तो उसको टेस्ट तो पता चलता है कि ये 6 में से क्या है, सिंगल है, दो है, कुछ तो पता चलता है. आफ्टर दैट एवरीथिंग कम्स टू प्रेडिक्शन. Everything comes to prediction based on rasa, what could be its possible guna. एंड क्या होता है इसमें, जो हम लोग कुछ काम किए हैं इनमें ना, तो हम लोग करते क्या है कि बाय रूल वी गो दैट इट शुड बी समान प्रत्यारोप द्रव्य, क्योंकि आप समान प्रत्यारोप द्रव्य को लेके ही जा सकते हैं. आप विचित्र प्रत्यारोप को आप कल्पना करेंगे तो सब कंफ्यूजन है. ओके, सो ऑन बेस इफ अगर मेरे पास कोई इंफॉर्मेशन नहीं है हर्ब के बारे में, ये कैसे काम करता है, क्या एक्टिविटी रिपोर्टेड है, कुछ भी नहीं है, एंड ओनली हमने इसकी टॉक्सिसिटी एस्टेब्लिश कर दिया कि ये सेफ है. उसके बाद हम रस निर्णय करते हैं. उस रस के आधार पर, समान प्रत्यारोपधत्त के आधार पर हम उसकी गुण, वीर्य, विपाक निर्धारण करते हैं. देन वन हैज टू गो टू ट्रायल ओनली. देयर इज नो सेकंड वे ऑफ कंफर्मिंग व्हाट प्रेडिक्शंस यू हैड. बट होता क्या है, कुछ हर्ब, बहुत रेयरली ऐसा हर्ब आता है जिसके बारे में कुछ भी पता नहीं होता है. ये चाहे कहीं से भी हो, कुछ ना कुछ रिपोर्टेड एक्टिविटी मिल जाता है. ठीक है. जब रिपोर्टेड एक्टिविटी मिल जाता है तब हम अपने प्रेडिक्शन के साथ उसको लिंक करते हैं. अरे नहीं, अगर ये मधुर रस का था और ये पित्त संशमन करना चाहिए था, लेकिन ये रिपोर्टेड एक्टिविटी बोल रहा है कि ये तो हाइपर एसिडिटी करता है. सो दैट मीन्स ऑन लेवल we know that we cannot predict this as a saman pratyarabdha dravya. It will have some different things. So this type of predictions continuously goes, sir. And because हम लोग का जो शास्त्र है वो एक्सपीरियंस बेस पे ही चल रहा था. एंड ये जो काम करने के लिए मॉडर्न रिसर्च में अधिकतर टूल को डिपेंड करते हैं, और आयुर्वेद की जो टोटल कॉन्सेप्ट डेवलपमेंट हुआ है वो डिपेंड करता था हाउ कीनली यू कैन ऑब्जर्व. अगर आप अनबैस्ड कीन ऑब्जर्वेशन आपके पास है तो आपकी सामने से ऐसी कोई भी ऑब्जर्वेशन या कोई भी इंसिडेंट क्या बोलते मिस नहीं होगा. बट अनफॉर्चुनेटली I don't know how whether I should say it or not, in the current situation when we are doing research, the biggest drawback that we all have as researchers is that हमारा observational capability using our sensory faculties is very bad. हम लोगों के सामने चीजें घट जाती है, हमें दिखता नहीं है, हमको पता ही नहीं चलता. हमारे पास कितने भी बढ़िया टूल हो जाए, वो टूल उसको कैप्चर करेगा ना. अल्टीमेटली वी हैव टू परसीवर एंड वी हैव टू व्हाट यू कॉल कोरिलेट इट. हमको दिखाई नहीं वो हुआ तो ठीक है. और जबकि पूरा पूरा आयुर्वेद जो था वो कीन ऑब्जर्वेशन में था. आप देखेंगे कुछ कुछ जगह ऐसे पर्यायों की नाम दिया है जहां वो फेनोटाइपिक सिमिलरिटी होने के बाद भी जेनोटाइपिक डिफरेंस को ऑब्जर्व कर लिया उसने. ठीक है. विदाउट एनी माइक्रोस्कोप. ये इतना ऐसा नहीं कि वो एक दिन में किया होगा. ठीक है. मे बी उनकी पूरे जनरेशन, दो चार, एक घर की एक जनरेशन ने ऑब्जर्व करके इसको बताया. बट somehow other they caught that information ना. तो हम लोग आज रिसर्चर क्या करते हैं ना, अभी टूल के ऊपर ज्यादा फोकस करते हैं और हम अपने आप को मानते हैं कि हम गौण है इसमें, वी आर सेकेंडरी. लेकिन हमारा जो 5 सेंसरी फैकल्टीज है वो तो मोस्ट इम्पोर्टेंट टूल है किसी भी रिसर्च में. है ना. तो दिखता है, ऐसा नहीं कि नहीं दिखता है. अगर कोई हर्ब है तो दुनिया में पहले से, हमसे पहले आया है, तो कहीं ना कहीं से इंफॉर्मेशन मिलता है. हमने, इंसान नहीं खा रहे हैं तो कुत्ते खा रहे होंगे, गधे खा रहे होंगे. वो जिसने ऑब्जर्व किया वो साइंटिस्ट बन गया, जो नहीं ऑब्जर्व किया वो प्रश्न करते रहेंगे.
ओके, थैंक यू सर.
हाँ, थैंक यू.
The last query is from Dr. Kavita Mule. Please unmute yourself and ask your query. Dr. Kavita Mule.
कविता जी है या गए?
Dr. Dharmen Kumar Pandey, please ask your query. I sent you the unmute request.
नमस्कार सर।
पांडे जी बोलिए।
जी सर। सर किसी भी अज्ञात औषधि का जैसा आपने बताया कि वो टॉक्सिक है या टॉक्सिक नहीं है, ये जानना बहुत जरूरी है अगर उसके हम लोग रस परीक्षण की बात कर रहे हैं।
जी जी।
तो मैं ये जानना चाह रहा हूँ सर कि क्या हम लोग के पास कोई ऐसा तरीका है, जैसे किसी कोई भी अज्ञात औषधि हमारे हाथ में आती है तो हम जान पाए कि इसके विशेष प्रभाव होंगे या नहीं होंगे?
सर दो ही है रास्ता। ठीक है, मैं थोड़ा सा क्या बोलते हैं, तो इन पर्सन क्लास होता तो सब लोगों को थोड़ा बहुत हंसा देता, पर यहाँ तो मुझे भी काले काले दिख रहे सब कुछ। ठीक है।
नहीं सर,
अब
आप बताएं सर।
जैसे अग्नि है ना, वो गर्म
जी
है, तो पता
जी सर।
करने की दो चीजें हैं, खुद के हाथ जलाओ, हाँ, या किसी के जले हुए हाथ को देख के समझ जाओ,
जी सर।
है ना। ऐसे ही अगर कोई विषाक्त द्रव्य विष है कि नहीं है, तो किसी ने खा के मरा हो तो आपको पता है कि मरने की चांसेस है, नहीं तो खुद खा के मरो तो फिर आप बता नहीं सकते किसी को। इसलिए आज की तारीख में एनिमल एक्सपेरिमेंटेशन ही होता है, उसको ओरली देते हैं, अगर उसमें कोई एनिमल का मोर्टेलिटी नहीं हुआ तो फिर लगता है कि सेफ है, यही चलता है सर ना।
जी सर। जी सर। जी
और
सर।
खुद खा के
हाँ सर, वो
अगर
तो बड़ा डेंजरस है सर, बिल्कुल सर।
नहीं, वही है, अगर वही है ना, अग्नि गर्म है जानने के लिए खुद अग्नि को पकड़ेंगे, वो भी एक रास्ता है,
जी सर।
पर इसमें थोड़ा रिस्क ज्यादा है।
नहीं नहीं सर, रिस्क नहीं लेना है सर, क्लियर सर।
यूजुअली ना थोड़ा बहुत इंफॉर्मेशन मिल जाता है कहीं ना ड्रग का, कि कौन यूज करता है, किस प्रकार के एनिमल यूज करते हैं, वही है कि कितना हमारा ऑब्जर्वेशनल कैपेबिलिटीज है, मिल जाता है। अगर नहीं मिलता है तो हम चले जाते हैं, अपने पास सफेद चूहे हैं जो खाएंगे, मरेंगे तो ठीक है, नहीं मरेंगे तो हम खा के जी सकते
जी सर। जी सर।
हैं। ऐसे ही
ठीक
चलता है सर।
है, ठीक ठीक, थैंक यू सर।
हाँ जी, वेलकम।
Sarika ma'am, I think the query session is over now.
Okay,
कविता
thank
जी
you, Amit
वापस, कविता जी वापस आए, करना है क्या, आंसर देना है क्या? सारिका जी पूछिए।
Dr. Kavita, आप सुन रहे हैं? Dr. Kavita,
हेलो।
जी मैम
कविता
बोलिए।
जी बताइए।
हाँ हेलो सर,
बिल्कुल
आवाज आ रही है ना मेरी?
बिल्कुल बिल्कुल, आवाज है।
हाँ, वेरी नाइस इंफॉर्मेटिव लेक्चर सर।
जी
मेरी क्वेरी ये है कि अगर क्वाथ जो है उसको घन में कन्वर्ट किया पैलेटेबिलिटी के लिए, तो उसमें रसवीर्य विपक चेंज हो सकता है क्या उसका? सपोज
मैडम।
दार्वेदी घनवटी है, उसको अगर मतलब दार्वेदी क्वाथ का रेफरेंस है और उसको दार्वेदी घनवटी में कन्वर्ट किया, तो उसको
जी जी
चेंजेस हो जाएंगे क्या?
मैम, वो कल्पना परिवर्तन आप कर रहे हैं ना, द्रव्य परिवर्तन थोड़ी कर रहे हैं, कल्पना
हाँ
परिवर्तन कर रहे हैं, तो कल्पना तो युक्ति पे चलता है ना,
हाँ
युक्ति पराधिक गुण में चलता है मैम ना। तो
हाँ
कौन से द्रव्य कौन से कल्पना में युक्ति युक्त रहेंगे, वो
हाँ
ट्रायल एंड एरर चलता है ना मैम। तो
हाँ
क्वाथ से आपने घनवटी में कन्वर्ट कर दिया, तो
हाँ
वो फार्माको इक्विवेलेंट है कि नहीं, दैट नीड्स टू वेरीफाइड। अभी वेरीफाई नहीं हुआ है, हो सकता है उसकी एक्टिविटी चेंज हो गया हो सकता है उसकी एक्टिविटी की इंटेंसिटी बढ़ गया हो, या हो सकता है पूरा इनएक्टिव हो गया हो। ठीक है, त्रिफला घनवटी के आपको एग्जांपल दे रहा हूं। ठीक है।
हाँ, यस सर।
त्रिफला नहीं, हमारे हमारे यहाँ हुआ हरितकी घनवटी। घनवटी क्यों बनाना है, क्योंकि रोगी बोल रहा है मुझे चूर्ण नहीं खाना है।
हाँ
ठीक है।
यस सर।
अब
हाँ
रोगी डिसाइड करेगा उसको क्या खाना है, कि डॉक्टर डिसाइड करेगा? जिसको बीमारी है, जिससे सही होगा
वही,
वही खाना पड़ेगा ना।
यस सर।
लेकिन आज की कॉमर्स के हिसाब से नहीं नहीं सर, टैबलेट बढ़िया है, रोगी को पसंद है, टैबलेट बनाएंगे। तो उन्होंने
यस
त्रिफला को घनवटी बनाया और टेस्ट किया क्या है,
यस
इसकी इसके अनुलोमन एक्टिविटी। ठीक है।
यस। हाँ
और वो बोल रहा है हरितकी शीर्ण होने पर संग्रहणी हो जाता है।
हाँ
ठीक है। तो
यस
आप हरित की चूर्ण को घनवटी बनाया कि उसको खाने में आसानी हो, लेकिन जिसके लिए खा रहा है तो काम तो हो नहीं रहा है।
यस
ठीक है,
सर।
तो हर जगह वो काम करेगा ऐसा सोचना सही नहीं है। दिस इज वन पॉसिबिलिटी दैट वी कैन रिड्यूस द डोज क्वांटिटी एंड वी शुड ट्राई दैट पेशेंट शुड आई मीन पेशेंट की कंफर्ट तो देखना भी चाहिए, लेकिन पेशेंट की कंफर्ट आपकी थेरापेटिक आउटकम को कॉम्प्रोमाइज करके नहीं होना चाहिए ना,
यस सर।
है ना। अगर मुझे कोई बोलेगा कि मुझे कड़वा लगता है मैं खाऊंगा नहीं, हम कोशिश करते हैं वो कोई मधुर द्रव्य मिल जाए दे देंगे, लेकिन उसको सही नहीं कर पाएंगे तो फिर मधुर दे का मतलब क्या।
नहीं सर, उसका मेरा ही स्टडी चल रहा है, वो आयुर्वेदिक बात पे, मतलब उसमें कन्वर्ट करके आयुर्वेदिक वटी बनाया, लेकिन उसके रिजल्ट तो अच्छा है, मतलब उसका डोज जो है वो उसके क्वाथ के हिसाब से ही रखा, इसलिए।
हाँ नहीं, अब देखिए वो तो स्टार्टिंग है ना मैम। जैसे आपने क्वाथ लिया तो जब आप उसको घनवटी बना लिया, आपके पास दो चीज देखनी है। एक तो कि आप क्वाथ को जिस पैरामीटर से इवेलुएट कर रहे थे कि ये कार्यकारी है कि नहीं, उन पैरामीटर में आपकी घनवटी कार्य कर रहा है कि नहीं कर रहा है। दूसरी
यस।
दूसरी बात ये होता है कि स्टार्टिंग डोज तो हमेशा हमेशा इक्विवेलेंट रहता है कि मैं 40 ml या 80 ml क्वाथ देना चाहता था, उसके बदले में 300 mg आया तो 300 mg ड्रग जाएगा। ठीक
यस।
है, लेकिन लेकिन जब हम फार्माकोलॉजी में रिसर्च करते हैं तो कभी कभी ऐसा होता है कि वो लिनियर ट्रांसफॉर्मेशन ऑफ डोज नहीं होता है। कभी कभी हम 80 ml 300 mg तो फिजिकली कन्वर्सन हो गया, लेकिन फार्माकोलॉजिकली हो सकता है 500 मिलीग्राम जरूरत है, हो सकता है कभी कभी 125 मिलीग्राम में काम हो जाता है, क्योंकि आप
यस।
कंसंट्रेट कर दिया ना। बट दीज आर
हाँ।
एक्चुअली मल्टीपल डोज में जब काम करते हैं ना तब पता
हाँ।
चलता है। बट बिगिनिंग में आपको इक्विवेलेंट लेके चलना पड़ेगा,
यस।
जितना भी आपकी आउटपुट है ना वही डोज है उसका।
यस, यही पूछना
ठीक है,
था सर।
चलिए, थैंक यू।
थैंक यू सर, थैंक यू वेरी मच।
Thank you very much, sir, for such a nice session and for solving all the queries so nicely. Now, I would like to invite the chairperson of today's session, Professor P. Hemanta, sir, uh, uh, to kindly conclude this session. Sir is currently working as Professor SAG in the Department of Shalya Tantra, National Institute of Ayurveda. Sir is also Dean PG Studies, NIA Jaipur. Sir is having more than 25 years of teaching experience for PG studies. Sir is recipient of many awards like Acharya Award, Sudipt Rath Award, Best Teacher Award, Best Doctor Award, Janhit Manch Award, Young Sushruta Award. Sir is having to his credit 6 books published and more than 100 articles published in various peer-reviewed national and international journals. Now, without taking much time, I would like to invite Sir to kindly collaborate this session.
Okay, thank you, Dr. Sarika. Is my voice is audible?
Yes, sir, audible.
Okay, first of all, I highly appreciate my dearest friend Dr. Sudeep, and I really appreciate Sudeep for nice presentation and with interaction with various scholars, students, and delegates of today's program. And he analyzed various methods of Pariksha and need of Dravya, Pariksha and research aspect. And very important is different types of Dravya Pariksha like Ukta Dravya Pariksha, Anukta Dravya Pariksha, and approach to Pariksha. And various aspect he analyzed, and really I appreciate about depth knowledge regarding Dravya. And why? Because the time is not sufficient. Why? Because he is constant about rasa, and definitely in further classes, and he will analyze about Guna, Veerya, Vipaka, etc. but really appreciate the depth knowledge in the subject of research in Dravya and other aspects. And in all aspects he covered regarding the rasa, significance of rasa, importance of rasa in chikitsa, and pharmacological tool and molecular basis of rasa, and related to all the aspects related to the rasa, and definitely, and every scholar is enjoyed about this topic. And once again, I congratulate Dr. Sudeep for nice presentation with a good interaction. And I'm very thankful to Dr. Sarita and Dr. Yadav, Chajuryam Yadav. They give an opportunity to share my views in this certificate course of research methodology. Thank you and good night.
Thank you very much, sir, for nicely summarizing today's session. Thank you.
Sarika ji, thank you, Amit ji. Thank you, Hemant sir.
Thank you, thank you.
Thank
नहीं
you,
दिख
sir.
रहा, अभी दिख रहा है. गुड नाइट.
अभी बंद कर दिया था सर, मैं ऊपर.
हाँ, वो बंद कर दिया. ठीक है, ठीक है. ओके, ओके,
ऐसे ही
ओके.
स्टोर रूम में कहाँ आवाज आ रही है तो चुप करके बंद कर दिया.
अच्छा
चलिए
लगा.
सर.
वेरी गुड. ऑल द बेस्ट, ऑल द बेस्ट. ओके, ओके, ओके. बाय, बाय.
Thank you everyone for being here in this session. Now the session is over for today. Tomorrow we will meet at 6 p.m.
Thank you, Sarika ma'am, for organizing today's session. Thank you all participants for joining today's session, and thank you for the resource person, and thank you the guest speaker for presenting today's session very nicely and discussing all queries. And one important new information is there for our participants who are having any queries regarding the notes, PPTs, and recorded session. I request you to, if you have any query regarding operating the statistical app or any other thing, then you may call us directly on given numbers or mail us during the working hours 10 to 4 p.m. So I will help you to operate and access the recorded session and PPTs. All PPTs will be, all PDF notes will be shared by tomorrow till 5 p.m. So if there is any query regarding, then you can drop a message on the admins of the group created on WhatsApp. Thank you very much.